Hello, my name is Fawn Connell, and I am currently attending Northwest College in Open Studies. One of my professors is Dr. Reg Nugent for one of the health classes that I am required to take in hopes of transferring into the social work diploma program. So today I'm going to be talking about FASD, or fetal alcohol spectrum disorder, which was formerly known as fetal alcohol syndrome, or FAS. It was first discovered in 1973, and the change of terminology is to reflect how it affects certain individuals more or less than others might be. For example, anecdotally, I know someone who has the condition FASD and they work as an electrician. However, I also know someone with FASD whose IQ is 62 and they're still learning how to write their own name. And you know what? We celebrate where people are, so that's okay. FASD is kind of a unique diagnosis because it is one that on the surface seems to be completely preventable. For example, like if a birthing parent has all the supports that they need to get through the pregnancy, to have moved past their traumas, which studies have shown are inconclusive on how likely they are to give birth to someone who's affected by FASD. But regardless, studies have also shown that trauma plays a great factor into addiction and such. And if one is addicted to alcohol, it's clearly going to be a little bit more challenging for them to stop it, even if they are pregnant. So approximately 10 to 20% of pregnant people have admitted to continuing alcohol use throughout their pregnancy, regardless of if they have a diagnosis of PTSD or RAD, post-traumatic stress disorder, or reactive attachment disorder, for example. So there's that. It tends to be a little bit higher in younger populations. I would personally attribute that to just be because like a little bit less informed about sexual education in general, perhaps less informed about teratogens, which are factors that can influence a fetus's positive development, I guess we can say. Something as extreme as alcohol use or drug use, such as methamphetamine or heroin. Marijuana has inconclusive studies on how it can affect a fetus. Perhaps a low birth weight, but studies are inconclusive on any sort of factors or diagnoses beyond that. And of course, the main topic, alcohol. What is interesting is that alcohol tends to only create the visual symptoms of fetal alcohol spectrum disorder, FASD, such as like smaller ears, a very flat philtrum, low set upper lip, microcephaly, which just means the skull is a little bit smaller. And you know, it's interesting. I like to say that FASD is not just a micro disorder, not to be confused with microcephaly, but it is a macro disorder, in my opinion. So people like micro being affects only one person or on a very individual level, whereas macro can be like effects of society. So regardless, some of the physical features of FASD, including microcephaly, flat philtrum, small ears, low eyes, they'll tend to be a little bit more sunken in and they might have a secondary eyelid, bone deformities, like just, you know, there's a typical Homo sapien skeleton and there's someone with FASD. They might have low foot arches, or their fingers might lack dexterity. Regardless, we've all got our differences. So, the most visual effects of FASD are actually only present if the birthing parent consumes alcohol throughout days 17 and 22 of the pregnancy. Another interesting tidbit that I found in my research is that mice, throughout studies, mice can actually get some of the same physical facial features of FASD if their birthing parent is exposed to alcohol as well. Which, obviously mice are probably not going to be, but just for the sake of science, I guess some mice were tested upon and results showed that, yeah, they can have smaller ears, smoother philtrum, lower set eyes, the whole bit. So yeah, there's that. Unfortunately, one of the most common comorbidities of FASD tends to be ADHD, or attention deficit hyperactive disorder, which can include sleeping difficulties, eating difficulties. Some people experience cognitive delays, and one of the most invasive symptoms, at least in my personal experience, is executive function. So, if someone already has a diagnosis of FASD, they likely have a diagnosis of ADHD also. And so if they're lacking cognition, they might also lack the ability to overcome executive dysfunction the way that someone who is diagnosed with ADHD but not FASD will. However, there is a lot of hope. There are many agencies throughout Edmonton, Alberta, the rest of Canada, thankfully, that will provide some supports to individuals living with FASD. For example, canfasd.org. In Edmonton, the Bissell Center offers a primary school completion diploma program. So someone who may or may not be capable of finishing their Alberta grade 12 diploma on their own, they can attend the Bissell Center program, where there are people who are completely trained in FASD awareness and such, and learning techniques. Additionally, some of the costs associated with FASD are, according to a study in Finland, 55,500 euros per year, simply because the disorder affects so many aspects of a person's life, from facial differences, potentially, to learning abilities, to balance coordination. And so a lot of studies have shown that physiotherapy or osteotherapy or massage therapy and behavioral therapy can indeed improve the lives of an individual living with FASD. So, worldwide studies have shown estimates varying from 0.1% to 11% of the population being affected, just depending on where one is. In Canada, most studies have shown that it's approximately 4%, which is equivalent to 1 out of 25 people. Of course, certain populations are unfortunately more affected than others, such as potentially Indigenous groups, simply because of residential schools and the 60 scoop and a lot of negative happenings. But regardless, alcohol is a teratogen, which is a substance or disorder that can negatively affect a developing fetus. And if one knows a pregnant person, I personally feel that it's very important to support the pregnant person throughout their journey of pregnancy, whether they choose to terminate, whether they choose to continue throughout the birth. And if they do, perhaps an organization such as Dry 9 can help someone out. Thank you so much. Bye-bye.